The summit was fantastic in regards to allowing people that work in the space of helping veterans recover from their experiences collaborate to provide, veteran-centered care across the spectrum of difficulties that they face. And in particular, I found it particularly powerful to hear about the transitions from the transition panel and the struggles that people face as moving from their military experience to back to society. And for me as a psychiatrist, I feel like that's a really big problem that we see in our clinic constantly. Transitions throughout life are a challenge, but they're particularly challenging for veterans and can result in significant isolation and significant medical and psychiatric difficulties that really impact their quality of life. The way we deliver care regarding brain injury is different, and it's different because we put the patient at the center of care, or the veteran at the center of care, and allow them to collaborate directly with their entire clinical team in real time. So the first interaction with us is literally in a room with all of their providers, telling their story one time. And this rapidly establishes trust. And healing proceeds at the speed of trust. And so once we can establish that trust, then we can really collaborate together to find out what's important, put the right specialists on those problems, and do this a collaborative care model that allows rapid improvement of symptoms. And for brain injury, those symptoms cross a lot of lines. There's physical symptoms like vestibular, ocular motor, visual disturbances, speech difficulties, dizziness, as well as mental health concerns like post-traumatic stress and other associated conditions that are commonly found in people with brain injury. This is an evolving area of medicine, and we're all learning on how best to treat these sorts of injuries, and there's constant data emerging. And we have a strong partnership with the Avalon Action Alliance and 7 other academic centers nationwide that are treating these sorts of injuries within this treatment model. But it's not fixed cookie cutter. We all have our areas of specialization. We're all learning together. But we're also sharing data in real time to improve the process. The goal of Avalon Action Alliance and the goal of University of Florida in our program is to change the way we do brain injury treatment or concussion injury, not just for veterans and first responders, but for all people with these sorts of injuries. And so, there's a proximal mission with veterans and first responders, but then there's a global mission to improve the field of medicine in this area. I would love to let people know that, first of all, these types of injuries are very common from a relatively young age throughout our lifespan. Military populations are particularly vulnerable due to the nature of their training and the nature of combat. And so, that said, what has been poorly understood through the decades is what is the chronic presentation of these sorts of injuries. And we used to say, oh no, it's just if there's nothing wrong on an MRI, or there's nothing, you go to the doctor and say everything's fine. What we're discovering is actually there are very real and present symptoms that persist across the lifespan, that go across physical and mental wellness concerns, and can result with other considerations like substance use and other things that can occur as a result of symptomatology that present with these injuries. I think we can do a better job of being able to diagnose these injuries appropriately, treat them acutely, so that we can avoid some of these long-term consequences before it manifests in more severe illness over time. So I think we're just learning on how to do that, and it's an exciting time, and I'm optimistic that in the future we'll do a better job when these injuries are happening about mitigating the long-term effects and the level of suffering for people that have these types of injuries.